because I didn't go into orthodontics. Actually, my father, grandfather, uncle, and brother all are orthodontists. I worked for my father in the laboratory for many years and felt like I pretty much knew how orthodontia worked. And when I was in college, I wasn't sure, but considered orthodontics, but I decided, no, that's not what I want to do. I graduated from college. I was out a few years and decided, well, medicine I think is more interesting. That's where I'm going. So I went to medical school instead. During the third year of medical school, students go through the various rotations, the clinical rotations, and get introduced to the primary specialty areas. I really enjoyed obstetrics and gynecology more than all the other clinical rotations, but during the residency I had an opportunity to work with a faculty member who had trained at Jones Institute in Norfolk, Virginia during the time when they developed their IVF program. So when I came to Tulsa for residency, he had established an IVF center in Tulsa, and I had an opportunity to work in that IVF setting with that faculty and some others. It was very new. It was the only program in Oklahoma, and there were really only a couple of other IVF centers in the country. So it was a unique opportunity for me, and that was my main attraction to the infertility subspecialty. My philosophy of patient care is really patient-driven. I like to determine what the patient's goals, needs, and desires are, help them decide what options that we have to achieve those goals, needs, and desires, and help them decide what kind of management approach is most appropriate for them given those circumstances. I try not to make decisions for the patients, but rather make sure that I provide them with sufficient information to make the decision that's best for them. That involves medical issues, personal, emotional issues, couples issues, financial issues. All of those things really go into the decision making for proceeding into any kind of medical treatment, but particularly for infertility. What brought me to Quorum primarily was looking for a partner. I had a solo practice for many years in Tulsa, Oklahoma. My wife and I had been looking for an opportunity to move to a different city, a little larger, somewhere in the Midwest, preferably south, a little bit warmer climate. Sometimes this is a little warmer than we like, but Tulsa also very warm. But coming to Dr. Schnell's office, I was impressed with the high quality of patient care, the high quality staff, and excellent patient population. The people here are just wonderful to work with.